Performing testing. QuickVue SARS Antigen. Performing testing with the QuickVue SARS Antigen test is quick and easy. The QuickVue SARS Antigen test is a visual read rapid antigen test for COVID-19. Understanding kit components prior to performing patient testing is necessary to ensure an accurate result is produced. Quidel provides all components necessary to run the test. Sterile nasal swabs used to collect an anterior nares patient sample. Liquid reagent solution that reacts with the patient sample to determine results. Reagent tube for mixing the patient sample and reagent solution to determine results. The test strip, which will display the results of the patient sample. The tube holder holds the reagent tube in place while performing the test. Reagent tube should remain in tube holder for all timed steps. Sample collection. First, put on appropriate personal protective equipment, PPE, including full gown, gloves, face mask, and eye protection. Next, instruct the patient to blow their nose to clear out excess mucus. Open the nasal swab provided in the test kit, taking care to hold by the shaft and not to touch the swab tip. Then carefully insert the foam swab tip approximately 1/2 inch to 3/4 inch into the nostril. While in the nostril, rotate the swab at least 4 times against the nasal wall, then remove and repeat the process with the same swab in the other nostril. Sampling should take about 15 seconds. Specimens should be tested as soon as possible. If transport of the swab sample is required, place the swab tip downwards into a clean, dry swab transport tube labeled with a unique patient identification. The swab must be tested within 5 days. Note: dry transport tubes are not included with the kit and must be purchased separately. Adhering to the proper collection, storage, and transport guidelines is crucial to obtaining accurate results. Test procedure. To begin testing, twist off tab and dispense all of the reagent solution into the glass reagent tube. Swirl the reagent tube to dissolve its contents. Note: reagent mixture should be utilized immediately after dispensing. Place the anterior nares patient swab sample into the glass reagent tube. Gently roll the swab at least 3 times while pressing the head against the bottom and side of the glass reagent tube. Leave the swab in the glass reagent tube and set timer for 1 minute. This step is very important. After the 1-minute timer is complete, roll the foam tip of the swab against the inside of the tube as you remove it to express as much of the sample as possible. When finished, dispose of the used swab in your biohazard waste. Place the test strip into the glass reagent tube with the arrows pointing down, then set the timer for 10 minutes. Do not handle or move the test strip until the test is complete and ready for reading. Note: the test strip must remain sealed in the protective foil pouch until use. At 10 minutes, remove the test strip and read results. Note: result must be read within 5 minutes after being removed from the reagent tube. Dispose of the used test strip and glass reagent tube in your biohazard waste. Interpreting results. The appearance of a blue procedural control line demonstrates that sufficient reagent solution flow has occurred and the functional integrity of the test strip was maintained. If the blue procedural control line does not develop at 10 minutes, the test result is considered invalid. If both the blue line and the pink line appear on the test strip, the test is valid and is ruled positive. Look closely. This is a positive result. Even if you see a very faint pink test line and a blue control line, you must report the result as positive. Note: a positive result does not rule out co-infections with other pathogens. If only the blue line appears on the test strip, the test is valid and is ruled negative. If the blue control line does not appear, the test is invalid. A new test should be performed with a new patient sample and a new test strip. Invalid test results should be considered null and void. This may indicate an issue with sample collection or test processing. External quality controls. External positive and negative control swabs are supplied in the kit and are used to demonstrate that the reagents and test procedure perform properly. Positive and negative controls must be run once for each untrained operator, once for each new shipment of kits, provided that each different lot received in the shipment is tested and is deemed additionally necessary by your internal quality control procedures and in accordance with local, state, and federal regulations or accreditation requirements. Tips for success. QuickVue test kits should be stored at room temperature. Components are lot specific and should be kept together in the kit box. For proper test performance, utilize the components included in the kit contents. Ensure all the reagent solution is dispensed into the glass reagent tube. Do not open the foil pouches until ready for immediate use. To avoid inaccurate results, adhere to the manufacturer's instructions. Reading test results before or after the specified time frame can produce inaccurate results. Do not read results after 15 minutes. This would be considered an inaccurate result. Technical support. For additional information, refer to the assay package insert and quick reference instructions. If you have any questions regarding the use of this product, call Quidel Technical Support at 800-874-1517 in the U.S. or 858-552-1100 or email technicalsupport@quidel.com.